Welcome to the Essential Substance Abuse Skills webinar series. I'm Kate Trans, and I'll be administering today's webinar. Today, Matt Ignacio will be speaking on professional readiness, attitude, and values. This training series is brought to the National American Indian and Addiction Technology Transfer Center, or ATTC. We are one of 4 national focus centers serving the ATTC network shown in this slide. The network also has 10 regional centers and a network coordinating office. For more, please visit our website. This series is to be a broad overview to preparing for written alcohol and drug certification examinations to enhance existing knowledge, overall competence in treatment. Please be aware that this series is not meant to stand alone, and previous education and training is necessary in order to pass alcohol and drug certification exams. We recommend that if you are preparing for an exam that you seek additional preparatory help, and let this course be tools you use to prepare. Our next webinar in this series is scheduled for July 16, when Matt will be returning to counseling. We are the American Indian and Alaska Native series, and we'll welcome Dan Dickerson on second to present traditional healing and motivational interviews with American Indian and Alaska Native adolescents. For more information on our webinar series, you can contact me at the email address or phone number on this slide. Our center is a NADAC certificational provider, and we'd be happy to provide CEHs for a $1 fee. The CEH request form is available for download in the file on the webinar screen, and I will also be sending a follow-up email to all who attended. Immediately after today's webinar, you'll be redirected to our GPRA evaluation. GPRA stands for the Government Performance and Results, and SAMHSA asks us to evaluate our events in order to comply with this act and provide improved performance assessment and accountability. This survey asks about your satisfaction with the event and will take less than minutes to complete. In advance for help programs. Before we start today's session, to go over a few instructions for the next system. To view the presentation in full screen mode, click on the full screen button in the right corner of the presentation pod, which looks like 4 arrows pointing. To return to the regular view, click the button. You'll be muted for the duration of this webinar. Please use the Q&A pod to share your comments, and we will address questions at appropriate times during the presentation. We would also like you to be aware that this webinar records participant attention time. Minimize the webinar or are working in another window, the system will record your participation as inactive, which may be in the number of CEHs received. Today's speaker is Matt Ignacio. Matt recently worked for the National Native American Prevention Center and has also worked at the Palm Center for AIDS Care and Support in men's health crisis. He has experience providing individual level therapy for HIV-positive clients and facilitating psychoeducation and supportive group counseling. I'm so glad to welcome him to our webinar series and share his expertise with you today. So with that, I will over to you at this time, Matt.
Good morning. Um, just today, it's a brand new day for on the East Coast. It's half the day's over, so you cut down your hours to go home. I just want to share a little quick story with you. Yesterday, this morning, I got up and was regretting or saying I am working with a client at work. I work for a profit native organization, and as many of your clients daily for whatever drop-in services they need, they come with a myriad of problems and life challenges and life stressors. And this one particular client is really getting to me, and I kind of maybe had let that go through. This morning, thinking, "Oh gosh, I could have done this, or I could have this way, or maybe I could have handled things differently." And I thought, "Oh my gosh, what, what on the table in today's webinar if I can't even get my own stuff together?" Um, and then I thought about it more, and I was like, well, information we tend to forget, or we tend to, um, we all sort of know it instinctively, maybe in school or through life experience. But I think today's information is not only information for you, maybe it's a reminder, but I'm hoping that you'll take some information that'll help you do your job better for today and tomorrow. So with that, presentation really is going to hopefully help you in refining skills and working with really all your clients. We'll discuss values into why we get into the work we do, the work that we do. We'll have some cultural consideration. What we actually mean when we say culture. Um, I think for any of what we do, it's building trust, especially true when we work with Native clients. Identify as American Indian, Native, and Hawaiian. Um, say a bit about supervision and looking at management. Certainly, if you have any questions with the audio or there's any challenges on your end, please let us know in the Q&A section there. So first off, let's look at some of the reasons why we do the work. It's what I refer to as clarification. Certainly, individuals work within standards of care to support a role in the helping professions. Ask ourselves, my knowledge and skills used am I getting the support I need for the people we serve? And do my individual practices or practice values conflict with patients' expectations? I've seen this happen. We work when we work with populations that we may not know a lot about. So if to help individuals in recovery and on the recovery process and they continue to relapse, are we placing judgment on those individuals? It can be a challenge, and we may need to explore. Certainly, the standards that by work for may patients in which we work. So, what are the and goals? Being our whose needs met, ours or the client. Improve upon the services to meet needs. These are all sort of global questions can certainly relate. Furthermore, the work that we do can be set forth. For example, the Code of Ethics for the National Association of Workers, which is it articulates the basic values, ethical principles, and ethical standards to guide social work conduct. These three values carry over into you know, and our office hours or the community was from 8 to 5 Monday through Friday. So the challenge to get them to get tested, the challenge for them to come back and get results for any test appointment. So maybe consider off an office possible. Like but rear it could also and as rearranging your office or the room furniture, removing any barriers to facilitate open communication. Rather than you sit behind a desk and there, why not put chairs around to one side of the desk so that there's no barriers to the communication? And if possible, consider the professional use of self of humor as a way to engage and build trust. It's important to certainly affirm culture or heritage. For Native clients, certainly asking about their tribal nation or community, asking sort of explain it for me. Um, Utilizing support actions, family actions. We've seen this well in the HIV with regard to medication. Um, when a family is involved in the care of the individual, and they're the ones that are like reminding the on this particular example, did you take your medication today? The individual, did she take her medication? Only facilitate adherence and and for that individual. So really taking into consideration the family and um access, individual access, cultural tradition regard to spirituality and practices. That can also be an avenue to build trust, build engagement, get somebody linked into care and to stay into care. And I, every talk that I do, I talk about how important they are. Literature does speak to the client-provider relationship regarding incentives. The question is really, is the client seeking only for incentives? And by incentives, I mean a $10 Walmart gas card, or a $10 Walmart card, or a $10 gas card, or a hot meal, or a chance to enter into a raffle, what have you. Is the client services just to get, or is the client personally motivated to access services, and then the benefit is the I think as long as the client is returning for services, you have the golden opportunity to engage and build trust. And as I mentioned earlier, service providers work from a positive service delivery model, and that encompasses working from a strengths-based approach. We certainly collaborate, identify, and exemplify strengths as a way to uh, convey authentic interest, and we're mindful of that. Acknowledge and provide support for positive steps already made. Again, scheduling an intake appointment is a huge, ginormous step, and we acknowledge that. You know, I think you have a really key role in moving the work forward. You can advocate lines, and that's a critical necessary if we're going to best services that. So when we're building trust, um, this does to ask, we're working within challenging systems or challenging with challenging structure. Who's being met? Mine or ours? And that's what my supervisor would ask of us whenever we made a decision on behalf of changing program design or, uh, um, for example, we were 12 weeks for, and that didn't really well with schedules and our individual counseling schedules, and so we had us go from 4 times a year cycles to 3 times a year. But the question was, well, whose needs are, and in fact, it was our needs that were being met. So we went back to the drawing board, figured out a way to provide 4 sessions of group, um, and we made, and that's just a small example. It's a question that really does, are we here to collect a paycheck and make our own selves happy, or are we here to provide and create change to work with? Some examples include, where you're located or where from. Is the office located in the community and frequently visits, or is it right dead smack in the middle of where you need to be? There can be complex organizational processes, barriers, steps, even just to get services. So the question might be, how can we streamline this process so folks don't have to jump through all these hoops just to get the services they need? Certainly, there can be staff biases with challenging clients. I speak. Um, I think requires more training and more conversations such as this, and more dialogue and more support between staff and supervisors. Um, and implementation of programs where providers do not reflect the community. So by that, if you're designing a program to serve the needs of Native women who
Great. So just a reminder to if you have questions, please type them into the pod, and we will to them as they come in. And we'll take another break in the middle of the presentation later for questions too. So if things come up in the middle of the presentation, please feel free to submit them anytime. We'll take a moment and answer them on in the webinar. So I don't see any coming in right now. Matt, if you wanted to just continue for now, and then we can take another break later.
Sure.
Great.
It's that you have to take it consistently, daily. It's a very regimented, scheduled um, intervention. And so this employee was saying, I had a really hard time getting the individual to remember to take her medication. But when the family got involved, the family she was living with, and I think cousins and then her own kids involved in the treatment of this individual, her adherence rate to medication went through the roof because then involved. The kids were waking up each day, Mommy, did you remember to take your medication? It was just that support, that facility success. So I get why most medical models only focus on the individual. Going back sort of the last slide talking about that the role of family can be really important in the role, I think, when working. Ties health can also call attention. There's a community nation. That's also something to be mindful of. Really appreciating the importance of modesty and non-education. Uh, and that might be a question and just be a whole nother. But understanding that in the Western world and for those of who um, with organizations that are very that were Western communication and asking questions, wanting really answers, and even ended questions can be a little in a sense. So a native-centric world can be one has a modesty um, approach to it, and that there might be a lot of communication, and just being mindful of that. Step two is understanding the role of Western medicine. For many Native people, Western medicine has ties to traumatic experiences. Um, medical may also be tied to other non-Native experiences. So, work care facility, someone's distrust of services you provide may have nothing to do with the facility because they heard stories of a completely different social service organization where they were treated badly. And it's not so much for your organization, it might be just a collective distrust of providers in general. So we have to be mindful that there's a sea of mistrust around this. And boarding schools were no exception. With the policy of taking the Indian out of the child and killing the Indian and saving. And this was federal policy. The Secretary in 1857 states American Indians were encountered an unbroken chain of civilization, and the only alternatives left are to civilize or exterminate. So if someone automatically trust of the services you provide, it may have a organization, but sort of this collective memory and historical trauma. Looking at step three is providing Native people. We are accustomed to explaining membership with other Native people, and explaining your role within the agency or within your community can be helpful. where you're from, if you've worked in other Native communities. Again, it's important to take time to establish a connection before any of the work can be done. Um, and this is something I do have to remind myself is that certainly can discourage personal interaction. Sometimes we get really locked into our roles and we forget that we're human just like our clients and that we better serve the folks we work with if we took it down. By that I mean, you know, let's be human. Let's create a personal connection rather than a provider and a client role. Maybe let the humans talk and figure out how we can help each other out or how we can help people. Providing for also includes shaking hands and small way to gather information. Okay, looking at step 4 is really explaining confidence. I find this very helpful. Native people, as I've said, can be highly distrustful of service providers. There's that weariness of Western medicine. Um, there may even be a personal connection or relationship with providers. So when we're talking about confidentiality, someone may be related to somebody who works in your organization and may not even want to come in for services. Here are some steps we can take to help facilitate and build trust. Um, to actually process step by step of what confidentiality means within your organization. For example, you might keep charts double locked. There might be limited access to their. There are obviously liabilities, and explain what those liabilities are and the legal ramifications if any of the confidentiality is ever breached. It might also be helpful to explain who and who does not have access to. And again, fully explaining why you would need to break their confidentiality. We talked about self-harm, harm, and abuse. Uh, when and I often on a personal note, when I go into an IHS facility for services and I'm a new patient and you fill out all the forms on a clipboard and then there's that uh, one of the many sheets you sign off confidentiality um, like just form and you're signing to that you understand their confidentiality process, but never throughout any face interaction or anywhere is that ever really fully explained. So I actually find this to be helpful because it sets the terms. Client knows when and how and why you would need to break a confidentiality and what the ramifications are if confidentiality is broken outside of those terms. That's just a little tip from me to you. Understanding circular migration for Native people traveling daily, weekly, or monthly from reservation communities to urban areas for work, education, care, love, sex, drugs, shopping, etc., etc. Um, so migrating from urban areas to rural areas for whatever reason can be just described as circular migration. Um, and for folks who live in urban areas, Native people who live in urban areas may return home to their reservation or smaller communities for family, community events, ceremonies, etc. This can be a challenge to treatment plan adherence, in whatever role you play. As a result, a Native person might be labeled as resistant, non-compliant, hard, unmotivated, when in fact, maybe they're just going home for a few weeks to take care of an elder or of a dying family member or for childcare or et cetera, et cetera. And that we can't jump and label folks when they're, you know, um, taking care of their loved ones. So that's my fifth step in how and sort of understanding and working with Native folks that I found helpful. I hope it. Um, I'll pause here if there's any feedback.
Great. So yeah, again, please submit any into the Q&A pod. Matt, that it sounds a little bit quieter than mine. Let you know you can the little microphone icon. It should turn yours up a bit. That might. Hear you a little better. If I might be a little bit louder, be closer to.
Okay.
I think that made a difference. Sounds good. Here, some similarities with the. I think he's referring to trust. Latino counselors or Caucasian or African cultures.
I think that's a great on that. Or did I? Go ahead and respond to that now. So I think, is it easy? If I can sort of maybe how I'll break it down into two categories. Um, and trusting. I think it makes sense if you're asking, connecting with a native client, native. That actually creates actually more problems because talking about the confidentiality piece. I've seen this with in tribal communities on reservations where the providers from the same, the clients from the same, they may not be related, but they the same people in the community, and the less likely to disclose information for fear information is going to get out in the community. So that can be a challenge. When when if the client is native and is non-native, whether they're
Wonderful.
Caucasian,
Yeah,
African
looks like that
American, etc.,
is all the
there may
questions
be a
we have
greater
right
opportunity.
now.
That
Please
client is going
continue
to
to
open up
submit
and share
questions
more
throughout, and we will
because
more
they're
questions when we get to the end.
might be less likely to know anyone else in the community. So I think, and it goes back to the notion of cultural. Um, we're really open and honest about learning about someone else's culture, and we communicate that both verbally and verbally. I think that's a great starting place, and I think um, it's really a great opportunity for us as providers to expand our practice and our skill set. Thank you. That's a great question. I wanted to talk about a little bit about supervision and how I think it's a really very important part of the process when working with folks. And when I say supervision, I know that there's a difference between clinical supervision and regular administrative supervision and evaluative supervision. Um, so lumping this all into one, I'm hoping that best case each one of you has a great clinical great administrative supervisor and the supervisor who does your ongoing evaluations. Um, but for all intents and purposes in the time frame, let's sort of break it down or leave it to the three. So certainly consulting with your supervisor and really ought to be a component of decision making. We know that it may not always be available. Supervision you receive may not always be um, your ethical obligation as a provider, helping professionals to seek supervision, um, and certainly do not work on your own case evaluation if possible. Now, I say that because I know that, like I said, we all don't work in the same, we all don't work for organizations that are well funded, that they have this great infrastructure that. Um, so, I outlined three goals of an effective supervisor, which are they're assuring the delivery of quality treatment and services. That is, a primary goal of theirs, that they create a positive work environment, help and facilitate your staff skills. Effective supervisors certainly set clear expectations that are understood by not only you, by them, by the entire agency, by coworkers. They provide feedback with respect, or respectful feedback, in a timely manner. They are able to teach needed skills and provide a supportive and respectful environment, and they certainly lead by example. Now, I don't know anybody who has had and can walk away from really, really amazing supervisors, and if you're lucky to have one, count your blessings, because very often that isn't always the case. There can be personality conflicts, there can be challenges with staff turnover, which make it difficult to have a really great supervisor. Can count on one hand the one time really great clinical supervisor, but that organization had a multi-million-dollar budget and could afford to have all that. Um, but remember, if you don't have it, we got to find a way where you can get that support because there's implications which can lead to stress. I'm going to go back one slide and sort of wrap up my thought around this. If you are an individual practice and you're not getting the help you need at work, that's a conversation that I think needs to start with at work. If you want to take it upon yourself and get an outside supervisor, there are therapists out there that can provide clinical supervision for you, maybe at cost, maybe at no cost. Um, you might consider starting a clinical supervision team where your coworkers come and present cases and discuss treatment options and discuss challenges. One of the best examples I had early on in my career was when I was starting I didn't realize I was doing this, but I was taking the work home with me at night, and it was impacting my ability to do my job the next day. And I didn't know what I was doing, but during clinical supervision, I was describing the challenges I was having with this one particular client, and my and the supervisor was like, "Well, it sounds like you're taking your work home, which is a big no-no." And so we worked out a way for me to not do that, and that was really actually through the support of my coworkers that we kind of created our own little policy where if we're really challenged with the client and the challenges that they're going through, and it's the end of the day and we still haven't been able to get to a place where we can walk away for the night and and go home and not have to continue thinking about it, that we would all support each other and before the day closes, go into a room and hash it out and get it off our chest so that we can go home and be present when we're at home. And I found that to be really helpful. And that's not clinical supervision, but it's a way to get support. So and that didn't cost any money, but we had all made the agreement that we would support each other if that needed to be done. Things that certainly we can do if we don't have the luxury of having an organization to provide all that. So when we don't have that, that's where we start running into problems. And by that I mean stress. And stress begins when a life situation or work situation knocks you out of balance, simply put. When situations are perceived and cognitively described as distressing, emotional reactions such as fear, anger, insecurity develop, leading to, um, you know, illness and disease. That's the worst case scenario, right? So we want to nip that in the bud before it gets to that point. And looking at from a biological perspective, that can include, your cognitive functioning, your muscles, um, certainly your skin, your glands, your hormones, and nervous energy, cardiovascular, gastrointestinal responses to stress can all happen, as well as psychological responses, which are thoughts and feelings. Um, and stress can not only from, but also in surrounding environments. So the example I used about at the end of the day, it was not only my interpersonal relationship, um, circle of friends and family after work, but I also sleep at night. And coming to work the next day, really having this, uh, thinking about what could be done with this client. How do I respond to this challenge? And thinking about it and then um, spilling over and um, being fully present and being able to help the other clients in the morning session. Um, and this is just a reminder, but certainly stress symptoms, diminished sense of humor, certainly challenges and changes in your sleep and eating. Um, your increased physical complaint, withdrawal, your job performance may begin to uh, time away from work, self-medication, you may be sleeping too little, like I said earlier, changes, um, and physiological changes, including migraines or headaches, can stress. Certainly, what we do have happen is burnout. Recognize that prevention, imagining, and your stress and prevent And these are questions that we ask of ourselves. And if we can answer these questions with, for example, are you easy to anger? Do you get frustrated easily? Are you more suspicious than you used to be? Do you get fatigued and run down? Do you find place emotion? If you're answering a lot with yes, maybe perhaps it's time to conversation with us in place. Maybe it's a conversation we have with our peers and colleagues at work. And if we can't get some, it's a conversation we have with our support network at work, our loved ones, and trying to find some solution. I think the bottom line, I think that's, if you're heading down this road is to actually get help and seek help. We don't want burnout, which is an emotional exhaustion, which the professional no longer has any positive feeling, sympathy, or respect for the clients. An adverse a work with psychological, physical behavior components often associated with fatigue, frustration. So looking at burnout, again, we want to avoid that at all costs. Certainly, we can be really with their job. Then as time goes on, we can start getting tired and sets in. Start noticing physical effects. Maybe you're sick, or you're getting headaches, or maybe you're catching a cold, or you're a little bit weakened, so you're getting sick more often. And stage 4 is more of a crisis area where actual develop. Um, as a result of your eating habits, you've now developed some health issue that you need to now address. And stage 5 is sort of a phase where it's the problems could be so severe that the illness that they cause is life threatening, and that's we don't want to get there. Simply put, sustained, unmanageable, painful stress. It's your response and it's your responsibility. Um, Certainly, when we are burnt out, that has implications for ethical practice, and burnout compromises your physical and mental health and social relationships. Certainly, seek help. Learn how to set boundaries and set limits. With saying yes to everything, learn to say no. Manage your symptoms. Certainly, get medical care if you need to get medical care. Seek deeper meaning in your work. Maybe perhaps you're just really bored with what you've been doing for the last 10 years. Mix it up. Find new interests and new areas and new challenges in the work that you know you love to do and that you're passionate about, but maybe just need to find a new area that, if you will. And again, your response is your responsibility. And I know that sounds a little harsh, but it really is true. If you recognize any of these symptoms or signs that you're headed towards burnout, please, I'm asking, seek help. And what's the saying where they say you can't take care of somebody else if you can't take care of yourself? I mean, that's very true in the helping professions. Um, you know, a little bit about stress management. There's a lot to be said about and activities designed to block stressors from resulting in negative consequences. And that could be as simple as going for a walk, a 30-minute walk at the end of the day. Easy done. Helps. Exercise is a great way to reduce stress. Eating a healthy meal. I know a lot of us are on the go. A lot of us um, may not have time for ourselves, but maybe scheduling in a healthy lunch, even at least once a week, can be better than nothing, right? Doing things that are active and physical, spending time outside of our work and more in our personal lives, reading, meditation. That's just medication. Maybe you do medication. I don't know, but meditation, listening to music, these sort of simple techniques, they're cost effective, they're low cost, um, and they can help. Um, Sarah, if you want to attend ceremonies, looking at parent spirituality as a source and a strength, certainly by all means tap into that. Volunteering in an area of work that's completely different from what you're doing now can help keep things fresh and exciting. Um, Certainly, time management too little. Um, Certainly, managing your time well and setting goals and prioritizing, being able to say no. Um, that's a challenge I think for most of us is being able to say no. The best intent to want to help. It's hard for some of us to actually say no. Okay, well, I want to thank you very much for taking time out of your day and prying your eyes off Facebook to spend an hour with me and Kate in this presentation. And I'm open to any comments or feedback or questions. You have my personal information there. You can always reach out to me. I may not have the answers, but certainly we can help talk and strategize, or I might know somebody that I can direct you to. So I just want to thank you very much.
So much, Matt. And like he said, please submit any comments or questions. We've got to take some of those questions now. I have one comment.
Awesome. I think,
Our,
Gustavo, sometimes it may mean that actually to get to where you need to get to have an improved life. It'd be a tough decision if you have dependents. You know, I've asked this of myself. I've asked this of relatives of the past. What's more important, your health or money? And I mean, you can't do your job unless you're healthy. And so sometimes there's some hard decisions that have to be made. And I'm glad you're doing better. And thank you for your comments. Appreciate it. Uh, yeah, Gustav, if you want to share with it, I know folks that have gone through that and have walked away with results and feeling really, really helped. Yes.
Yeah, I was just curious. The technique EMDR, is that something you're familiar with, Matt, or maybe Gustav? Wonderful. Um, yeah, just a couple other comments. Thank you so much for the informative lecture. Um, if we don't have any other questions, I'll give a few more minutes for questions here. So please submit them now if you have. While we wait for those to come in, I'll just give some final instructions here, and then I'll come back to those if any come in. Online as we close out the webinar, so you can be redirected to our survey. If the survey automatically pop up,
Thank
my
you,
email
Cindy. Appreciate it.
follow-up is a link to the survey as well as a link to the recording of this webinar. We hope you'll be able to again on July 16th for counseling, and
Well, I mean,
July 2nd for
really,
traditional
that's a
healing
challenging question. There's over
motivational
500
interviewing with
different Native communities, and
an Alaska Native
as
from
you know,
adolescence.
every community is little different.
Yeah, again,
From
I would
my
like to say thank you to
experience,
everyone.
what and coming from the
Looks like we
HIV
do
prevention
have a few
background,
questions here, so we'll go over
um,
those now. A question
without even
from
getting
Sydney.
into
Thank you for
community
sharing why it
attitudes
starts
and
when
norms around
dealing with
stigma, I
an
think what I
individual
saw as the most
feels
pressing
it
issue
is
was
important to keep this in
the impacts of
consideration.
poverty and lack
So,
of access to
you
that be
know,
medical, mental
women
health, social
within
service.
that as well,
So,
Matt.
um, and those of you who come from those communities or who are from a small town know
Um,
that
a
when you
question
live in a
from
smaller
Jeanette.
community, you
If you
have
are the
access
most
to
pressing needs in a
comprehensive
Native
services.
American community
So
that would
that
impact the
goes the same for folks who
client's
live on
needs,
reservations. It
what
can be
would you
challenging and sort of the
that?
fact that I'm sitting across from a native client sometimes in my mind, A, that they came in seeking help and that they were ready to ask for help, and B, that they're turning to you and that you have an opportunity to build trust. And three, there's maybe, that they're open to the process, whether they're showing it or not, that they're open to the process of getting help. Um, I think is where we put more of our attention to focus on. Great, now we have this connection. How can we only make it more stronger and more therapeutic? With boundaries in place, with limits, the terms clear and the expectations clear. Trust can only grow from out. I mean, that's really where the work begins. So thank you, Danette. I appreciate your comment. Just good luck and keep in touch and certainly come back for these other web great resource and thank you for your time. Appreciate it.
Wonderful. And then Gustavo just got back with the what EMDR stands for. That's eye movement desensitization reprocessing. So it looks like that is all of our questions. Matt, did you have any final thoughts you wanted to leave the group with? Wonderful. And yeah, thank you so much, Matt. It was great to have you with us. We look forward to having you with us again next month. And hope all of you join us again next month. And at this time, we'll close out the webinar. And please remember to take our survey. Thanks a lot.